How do you do? I'm Ross Vogelgesang. I'm here to discuss low back pain and leg pain, and I want to discuss an advanced non-drug treatment option called Nevro. My educational background, most recently I got board certified in addiction medicine. Several decades ago, I became board certified in anesthesiology. Did my residency training down in Oregon, internship in Tennessee, and then most of my formal medical training was done in Texas. I went to the University of Texas for a plant honors degree and a degree in zoology. There's lots of different things I like to do and play with. Certainly this device is one of them. I want to talk a little bit about pain generators because this is a very important part of understanding why we use this particular technique of therapy and why we do it the way that we do. There are different types of pain generators. A pain generator is exactly what it says. It's a generator that produces pain, and it can be from nerves such as nerve injury or disease to a nerve or irritation of a nerve or pressure on a nerve. That particular type of pain is called neuropathic pain. The other types of pain, primarily nociceptive as the contrast, is usually due to things like fractures of a bone, degeneration in a joint, pull or tear of a ligament, or other types of soft tissue injuries. And unfortunately, it's hard to tell the difference if the pain generator is neuropathic or nociceptive or possibly mixed neuropathic and nociceptive. Because of that, we kind of have algorithms that we use to treat chronic pain. Chronic pain usually starts with the simple things. First of all, it has to be chronic, which means it has to have been around for at least 3 months or 12 weeks. If it's less than that, it's considered acute or subacute. And if so, that would not qualify you for consideration of a spinal cord stimulator. So the single most important thing in considering a spinal cord stimulator is that they must have chronic pain. Usually when we're treating pain, we start out with pharmacological therapies, usually over-the-counter medications like Advil, Aleve, other non-steroidal anti-inflammatory drugs. We might make some lifestyle changes. For example, if you have a lot of knee pain when you run, maybe you won't run anymore. Maybe you'll start bicycling or doing more walking. You might also start some home therapy. As things get more complicated, your doctor might send you over to professional physical therapy to see if there's something they can do to help keep you moving. And usually movement tends to help reduce pain. If things are still progressing, not getting better, then we might consider things like nerve blocks. Whatever nerves are causing the pain, we might go ahead and block those. Then if necessary, destroy those nerves, either chemical ablations or radiofrequency ablation. We might also try things like epidural steroid injections. That typically helps reduce inflammation, which reduces certain types of pain. We can try other types of injections. And then usually that bottom tier is where we'll consider surgery, pain pumps, or spinal cord stimulators. I, of course, will be focusing more on the spinal cord stimulators. This is, again, kind of an algorithm of your pain journey. Over-the-counter medications, prescription medications, physical therapy, RFAs, the burning of the nerves. You can do cold RFA or thermal RFA. And there's also the nerve blocks, the epidural injections. Then you have your non-surgical candidates, which can also go on to spinal cord stimulators, or the ones who have surgery and they have a poor outcome of surgery. If they're not getting the pain relief they want, those can also be treated with spinal cord stimulators when appropriate. And then what is a spinal cord stimulator? Well, it goes into the spine and it stimulates certain things to reduce pain perception. The Nevro HFX is a small device that works inside your body to disrupt pain signals to the brain. The device is placed like an epidural injection. It's in the same day type situation. It's in the office. It's an outpatient procedure. It usually takes a little bit longer than just a simple epidural steroid injection, but not a whole lot longer. Usually you wear the device for about a week and you can see if it works. If it works, we'll consider going on to implant. If it doesn't work, then we won't. There are 2 types of spinal cord stimulators available in the United States of America today. They are defined as traditional stimulators, which usually includes things like Medtronic's, Boston Scientific, and St. Jude, and they usually operate between 2 and 1200 hertz, and this has been proven to be safe over the past 40 years. The newer device is called high frequency. It's a 10,000 hertz stimulation. The only device in America that has that capability is Nevro. This is also FDA approved and is superior rated device versus traditional stimulators. A superior rated device is a significant title. Superior means it operates better than any device like it in the field. This is the only device in chronic pain management that has a superior rating, meaning it is better than any of its competitors. I'll say it again slower. It is the only device with a superior rating in chronic pain, which means any other spinal cord stimulator that is discussed is considered inferior to high-frequency neurostimulation. That's a pretty big statement, and that is an FDA-approved statement, and category. There are only a handful of devices in medicine today that have a superior rating by the FDA. This has to be proven. And there are not very many medications or other devices that have been able to successfully do that. Nevro was able to do that. Now, spinal cord stimulator is a well-established approach to managing chronic pain. This is not a new concept. The frequency is. This particular device, like all other spinal cord stimulators, is drug-free. It is not addictive. Placing it is considered minimally invasive or minor surgery, meaning it is not a major surgery. Like all other stimulators, you have a trial first, and if that is successful, you go on to implant. And just as a brief aside, in Great Britain, they don't do trials. If they think you're a candidate for the spinal cord stimulator, they actually go directly implant because they don't want to waste the time of doing a trial first. They know Nevro is awesome. They just go ahead and go directly to implant. This device in America, you still have to follow the rule of trial first. If successful, go on to implant. You'll see my statistics at the end. You kind of wonder, why do we bother to do trials if they're so darn successful? Certainly something I've thought about, but it is still required in this country. And by the way, success is defined as achieving at least 50% pain relief with a significant improvement in activities of daily living. You can tie your own shoes, you can wipe your own behind, you can get dressed yourself, you can do your own cooking, your own laundry, your own dishes. That's how we define activities of daily living. This has to show significant improvement in quality of life and in pain management. And a 50% reduction is huge. If you saw a 50% reduction in your taxes, you would be elated. If you saw a 50% reduction in your income, you would be very, very sad. And that's what we mean by 50%. It has to be a dramatic improvement in your pain relief and a dramatic improvement in your lifestyle and to be implanted. Top of the page here, Nevro has revolutionized the treatment of chronic pain with spinal cord stimulators. I have been around practice of medicine for over 30 years. I have seen a lot of things come and go. I've been practicing pain management for almost that entire time. And I can tell you there were a lot of things in medicine that I thought were kind of a waste of healthcare dollars, and spinal cord stimulators were on my list. I did not use them back in the 80s when I first was in my residency training program. I did not use them when I was first in private practice because to me, it was just a waste of money. You put them in, a year later, you take them out. There is statistical value to back up what I've just said, but they just were not effective after a year or two of use. So I was not big into placing a multi-$10,000 device inside somebody that I knew within a year was not going to be effective anymore. The long-term studies on this particular device, the high-frequency spinal cord stimulators, shows that it is not just superior to the regular traditional stimulators, but it also has a longevity of years of efficacy. This is something new with spinal cord stimulators. They historically do not have any long-term efficacy. This particular device does. There's also been over 100,000, I'm sure hundreds of thousands by now, of people treated with HFX solutions since inception, which was in around 2015 is when we started using spinal cord stimulators here in the United States of America, this particular device. Nevro isn't addictive. It doesn't cloud your thoughts, doesn't cause drowsiness or constipation like pain medications do. Only Nevro can do both traditional stimulation frequencies between the 2 and 1200, as well as up to the 10,000 or more if they want to. They're the only one that can do both. None of the traditional stimulators can go above 1200. This device can. Also, this particular device is paresthesia-free at the higher frequencies. Typically with traditional stimulators, you feel paresthesias or sensations down your leg, and that tells you that, oh yes, it's changing that painful sciatica to kind of a wavy sensation. Fine, changing one paresthesia for another, that is certainly an improvement. A painful stimulation changed to a less painful stimulation. I can relate to that. But with HFX, you feel nothing, not even the pain. It's not there anymore. It has been decreased or eliminated entirely. You have to see at least a 50% reduction in your pain. But with the spinal cord stimulators that are traditional, typically it's associated with a different type of sensation that is less noxious. The other thing, you can try Nevro temporarily, and if you decide it's right for you, you can go on to implant. The trial procedure is pretty basic, pretty simple. It's a procedure very similar to an epidural injection. You can get some sedation. We also use local anesthetic during placement. Instead of doing an injection of medication, we just slide up a little tiny catheter or lead. It's kind of like a wet spaghetti noodle. It slides up in the epidural space. The lead is then connected temporarily to a trial stimulator, which is just to the right of that sentence. It's that blue and white piece. It's smaller than a hockey puck, kind of about the size of a flattened boiled egg, probably. And the white part is where it sticks to the skin. And then those leads are the two blue things that are attached to it. That's the little battery that does the programming temporarily while you're trialing the sensation. The picture at the bottom right shows a lead attached to the skin, and then the device is attached to that skin as well. That's a little battery device that goes kind of on the flank or the side of the body. And then that's your stimulation device. That's what you walk around with for about a week to see if it's working for you. You'll go home, you'll try it. If it's right for you, you go on to implant. And again, about 9 out of 10 of my patients say this is a life-changing benefit for them. This is a very important slide on evidence pyramid, and it has level 1 through 5. Level 5 is an opinion. It's an expert opinion, so it'd be my opinion is that Nevro is the best device in the world for spinal cord stimulation. Then you do case studies, that'd be a level 4. Case control study has a little bit more defined boundaries. Then you have your prospective cohort, and then the very top of the pyramid is a random controlled trial. The SINSA trial is the largest RCT trial conducted in spinal cord stimulator history. And guess who funded that trial? That's right, it was Nevro. It's also the first study to directly compare competing spinal cord stimulator technologies. It compared traditional stimulation at 2 to 1200 hertz to 10,000 hertz. It's also the first prospective randomized study to demonstrate the effectiveness of spinal cord stimulation in patients for both back and leg pain. Historically, spinal cord stimulators only treated radicular pain. This device was the first one to prove it treats both axial pain and radicular pain, the first device ever in the history of medicine. And then also resulted in HF10 therapy achieving a superiority label versus traditional spinal cord stimulators, and the first and only indication is a paresthesia-free spinal cord stimulator therapy. In the brief history of Nevro, they have done more quality studies than every other single spinal cord stimulator device in the United States of America combined. So this company is very big on research, it's very big on studies, it's very big on trying to do the right things by the company and by the patients that it serves. There is no other better company to work with for trying to get chronic pain control, especially related to neuropathic pain, which has historically been the most difficult pain to treat. Nociceptive pain responds to lots of different easy treatments. Neuropathic pain, far more difficult to treat. This is a prior back surgery. It's comparing how people do traditional stimulation versus HFX. Again, this is a head-to-head trial, and it's a level 1 RCT. So going back to that previous pyramid, it is a top-tier trial. RCT is level 1, highest level of efficacy of any study in the world you can do is a level 1. And this is the results of a level 1 trial comparing Nevro to traditional stimulators in treating prior back surgery. So these are people who've had back pain who still have the same or worse back pain after surgery. Notice these responses. Traditional stimulator is the gray one. It only got about a 4.5 pain relief, which from an 8 is okay. But if you notice, they didn't even get a 50% reduction in pain. So by definition of what we call success for this device, which is at least a 50% reduction in pain, they failed. And notice where HF10 is, 66.9% pain relief. Greater than 50%, they were the only one that was successful. So again, if you're going to be using a stimulator, you should be using a Nevro. It is the only one that has proven efficacy in treating chronic neuropathic pain. This is the device that should be used. And it is the best device available in America. Prior back surgery never produces superior pain relief. Here's another comparison. Again, we have traditional spinal cord stimulators compared to HFX or high frequency. This is a SINSA RCT trial at 24 months. Notice 76% compared to 49%. Again, traditional spinal cord stimulators failed to meet criteria of at least 50% pain relief. And then you look at it again and look at these numbers, 156, 1,131. I mean, these are huge numbers. And you'll see some other trials with other devices where they're using a number of 17 or 30 or 50. These are huge numbers and huge trials. And notice on the very bottom, highlighted in blue, 90% of patients are satisfied with their treatment. 90% thought that HFX was the solution to their back pain. This is treating neuropathic pain, the hardest pain to treat in chronic pain, with 90% approval ratings. I've been doing this job for over 30 years. I have never seen this in the history of my existence as a pain doctor. Non-surgical back pain and leg pain. This was kind of a funny one. The previous slide, just to point it out to you again, is prior back surgery. This one is non-surgical pain. And the reason that's important is a lot of people end up in surgery because they have back pain and leg pain. The surgeon opens them up, cuts out their disc, takes out some laminae, puts in a few screws and rods, and now you have post-laminectomy pain syndrome. This one is before they go to surgery. Should we go ahead and consider a spinal cord stimulator ahead of time? If you look at the indications for spinal cord stimulators prior to high frequency, it was after they failed back surgery, we would then consider a stimulator. Well, that doesn't really sound very smart if you think about it. If we can treat your pain without back surgery, doesn't that make more sense? If you have a stable spine, but you have back pain, all you want to do is get rid of the pain. Do you really need to have the surgery? Of course not. This is a study to say, hey, look what happens with non-surgical back and leg pain, and it's conventional medical management versus high-frequency stimulation with Nevro. And again, this is a level 1 RCT. The highest quality study you can do in the world is a level 1 study. This is a level 1 study. And notice how, wow, what a surprise. Look at this. The blue line, HFX, decreases pain dramatically from about a 7.5 or 7.22 down to a 2.2 and a 2.1. That's pretty nice. How would you like to go from a 7.2 out of pain down to a 2 out of 10? That's phenomenal. And notice that purple line, that's a conventional medical management. Again, kind of failed. Like I said earlier, I've been doing this for over 30 years. Neuropathic pain is very difficult to treat in conventional medicine. You try your anticonvulsants, your antidepressants, your tricyclic antidepressants, your topicals, your non-steroidal anti-inflammatory drugs, your opioids. You just don't get a lot of great success. You move over to HFX. Wow, look at this. It goes from a 7.2 down to a 2.1 and 2.3. Again, notice the parallel lines when you switch over from starting with HFX versus going through conventional and then adding HFX, they're the exact same. Those slopes are the exact same. They come down at the same rate. It takes about 3 months to get that pain level down to something like, wow, a 2. So it takes a little bit of time when we turn it on. It's not like we turn it on, the flashlight comes on and poof, you see everything. No, we turn it on. It takes a while for us to modulate those interneurons to get them to stimulate more inhibitory function so you feel less pain. And that's one of the things you need to understand when we put these things in. It doesn't work overnight. It takes time to get the stimulation programmed to get adequate pain relief long term. But this study's 18 months. With the traditional stimulators, you put it in 1 year and 12 months later, you're taking it out because it no longer works. This thing's 18 months is still getting great success. We also have 2-year trials showing it's still working great. If you look at the European studies, which they started HFX back in 2013, they've got 5-year data showing excellent pain relief after 5 years of use. So this device has some long-term use. It has longevity. It has long-term functionality. You do not get that with your traditional stimulators. And trust me, if Medtronic could prove they could, they would have already done it. They are the big gorilla in the group of spinal cord stimulators. They've been around since the mid-1980s. They've been doing this for decades and decades and decades, and their outcomes are not nearly as good as Nevro. This is a phenomenal company. It's a phenomenal set of studies here, and this is what I want to share with you. This is Nevro's only FDA-approved spinal cord stimulator for non-surgical back pain. I think you heard me mention at that last slide that typically we do back surgery, then we put in a spinal cord stimulator if the back surgery fails. This was the first time that we have thought about, hey, why don't we put in the spinal cord stimulator before back surgery? You know, Medtronic has been around since 1984 putting in spinal cord stimulators, and they didn't bother to think about that. Why? Because their device fails after a year. Nevro has longevity. They took the chance to prove that it could work for non-surgical back and leg pain, and it did. At 12 months, 78% of the people had at least 50% pain relief. That is pretty big, tough guy talk there. This is a great device. It works. If you got back and leg pain, we should at least do a trial and see if it helps. Again, enjoy significant pain relief. Almost 50% were profound responders of greater than 80% pain relief. To qualify for success, you have to have at least 50% pain relief. Let me read that again. 50% of the responders reported greater than 80% pain relief, and that's without back surgery. They've been suffering with back and leg pain for over 3 months, hence chronic pain, and they don't want to have back surgery, or they're too unhealthy to have back surgery. We do a minor procedure of minor interventional procedure, and we can reduce their pain by at least 50%, and 50% of the people who were responders got over 80% pain relief. That's unbelievable. And then improved quality of life, 70% of patients experienced functional improvement, increased freedom. 66% of patients were able to reduce or eliminate opioids altogether. These kind of statistics are phenomenal. We should be advertising this on every TV station, every radio station, and start putting spinal cord stimulators into people who are suffering unnecessarily. This is the thing to think about. Rescue therapy. What rescue therapy is, if you have a traditional stimulator, you're not satisfied with it, and you want to have it taken out and thrown away, this is a rescue therapy of HFX. So if you have failed your Medtronics and you're getting ready to have it removed, have us apply a Nevro battery to it and see if we can't get better pain relief. Well, it's really easy to kind of like say, oh, yes, I do that all the time and it works great. But it's always nice to have data to prove it. And if let's just go to the far right, academic centers. If you're an academician and you do a study that is not valid, that is considered unethical, and you actually lose your license to publish and to practice medicine. So if an academic center says, yes, when we do a rescue therapy, we get an 88% responder rate, that's a big, big, big deal. But notice that N is only 26. That's all right, 26 patients. Okay, well, I'm glad you got an N of, I got your N of 26, 88% responder rate, but at least they published a responder rate of 88%, meaning if you repeat this study at another institution, you're going to get similar responses. That does say something. Now let's flip to the other side, real world results publication. This is what different people report in the real world. Like, what is Australia saying? What is Great Britain saying? What is Canada saying? What's Germany saying? What's Japan saying? 79% responder rates, and their N is 90. 90 is not that big of a number. I mean, it's better than most other studies published in other spinal cord stimulator journals, but it's still not as impressive as the one in the middle, which is the Nevro Global Patient Registry. And what Nevro does is they keep track of every single device they put into a human being, and they find out, is this a rescue device or is this a placement device? And if it's being placed, is it placed for failed back syndrome? Is it placed for painful diabetic neuropathy? Is it placed for a mononeuropathy, like a failed hernia repair? Is it being placed for non-surgical low back pain and leg pain? And when they look at their registry and they see that they have 1,224 patients who had failed traditional stimulators and then put in a Nevro and reported a significant improvement in pain relief of at least 50%, that's considered success. They published an 83% preference for Nevro. So notice these numbers, they're all in the high 70s, high 80s. They're very consistent though. It's better than 2/3. So if you got a failed device, you're thinking about having it removed, try a rescue therapy with HFX before you throw the thing away. We can put in a whole new device, but let's try to keep it simple if we can. This is an opportunity for rescue therapy here. My experience, it's good. I get about 82% of my patients who have back and leg pain. They get long-term pain relief with Nevro. That's better than 4 out of 5. That is the best response of anything I've ever done in medicine to treat chronic back and leg pain. I do not get this kind of reaction with epidural steroid injections, with sympathetic nerve blocks, with peripheral nerve blocks, with medications. It is the best experience I've had in my clinic has been with Nevro treating neuropathic pain. Who's a good candidate? Well, first of all, you have to have chronic pain, which by definition means you have to have constant pain that has lasted for at least 3 months or more. Your pain must be nerve related to respond to this device. And the reason why is this doesn't really treat somatic pain, it treats neuropathic pain. So if you have a broken leg, this is not going to solve your problems. If you have a broken back, it's not going to solve your problem. If you have a broken back with neuropathic pain, it would help, but it'd be nice to have a stable back before I put one of these things in. And then you still have to have pain after trying medications and other pain management treatment options because these devices are not cheap. Now, if you do get approved to go on to have it trialed and implanted, Nevro does let you know what your beneficiary responsibilities will be before we ever do the procedure. And it gives you a very close estimate. If it says, oh, it'll cost you nothing, or it'll cost you $50 or $100 or whatever, they let you know that beforehand so you don't get some kind of surprise bill of whatever at the end of the procedure. It's, oh, by the way, yeah, I'm glad you're better. Here's the big giant bill. They'll let you know ahead of time what they expect you to pay. And then again, you can be a surgical candidate or a non-surgical candidate. The only thing I would say about being a surgical candidate, you may have something like a herniated disc, or you might have impingement or compression on the spine. that this device might work for to treat. But if you're at all unstable, I would be reticent or hesitant to want to put in a device in someone who has an unstable back. And that's something I would talk to you about personally during our discussions of this device. It's not something to be a surprise along the way. Oh, by the way, I'm not going to do it because you have an unstable back. It's something we would discuss far ahead of time. And again, most people would like to have a stable spine before anything is done, because if you have an unstable spine, you have a very high likelihood of a spinal cord injury, which could lead to things like paraplegia and quadriplegia. So again, it's not a difficult thing to understand why we'd want you to have stability before we consider doing aggressive pain management. In our conclusions, chronic pain is a common problem for many people, especially as we age. Many treatments exist, including things like over-the-counter medications, prescribed medications, physical therapy, massage, acupuncture, and many of those things do work very well. But spinal cord stimulators are not very well known, and that's what the purpose of this discussion is to educate you on what's available. And this is something that is relatively new. This is an advanced type of spinal cord stimulator called high frequency 10,000 therapy. That's what HFX stands for. It offers more pain relief, none of the tingling or paresthesias that the more traditional spinal cord stimulators use. And unlike surgery, you can experience a trial of HFX first. If it works, you're going to want to go on to implant. If it doesn't work, you don't. How many people have I met in my career who had that $250,000 worth of back surgeries? And when you say, hey, which back surgery you wish you'd never had? And they say the first one. And if they'd only gotten a chance to try it and find out how poor it was going to respond, they'd have never had the second, third, fourth, fifth, sixth, and seventh. So this one, it does give you the option to try it first. And if it's successful, then we'll go on to implant. If you need additional information, please contact Rod Snope. He's a representative in this area. You have a cell phone number as well as his email address, and feel free to contact him. Otherwise, contact me here at my office at Alliance Pain Center here in Western Olympia. Thank you very much for your time. Have a great day.